Head Start has been preparing disadvantaged 3- and 4-year-olds for school since 1965. The new evaluation system for Head Start, which has taken effect this year, negatively affects Head Start programs nationwide. This new evaluation system will cut vital funding to Head Start programs. Topics discussed here will be cuts in education, high qualification requirements for teachers, and closing down of underfunded programs. This new evaluation system will cut vital funding to Head Start programs. Programs left without grants will be forced to make drastic cuts in education, teachers, and even close down underfunded Head Start programs. Often these programs depend on grants to stay open when city, public, and state agencies lack funding for programs like Head Start. And the first subclaim of 1,800 programs within 40 states, a large number will shut down. Those programs not backed by the NHSA, the National Head Start Association, are likely to lose funding based on lower performance ratings. This will cause many children to be left behind in their education and parents without secondary options. In the second subclaim, the $8 billion funding Head Start is better spent educating centers rather than revoking grants already funding these programs. The U.S. Secretary of Education, Arne Duncan, stated, "These results make it clear that we need to build a more coordinated system of early care and education and to focus on key improvements to teaching and learning in the early grades." And according to the No Child Left Behind Act, the academic achievement gap between rich and poor, Anglo and minority is not only wide, but in some cases is still growing wider still. And the third subclaim, funding for Head Start will be at risk in 2013 when spending caps approved by Congress kick in. A congressionally mandated study on the impact of the 2002 to 2003 Head Start program was submitted to Congress on January 13, 2010. The study measured the cognitive and social emotional development, status, health, and behavior of approximately 5,000 3- and 4-year-olds who were randomly assigned to either a control group or group that had access to a Head Start program. So while Congress is busy ordering large studies that require many expenses, they are also working to cut additional funding with spending caps to this vital program that they are already making grant cuts to. They expect and require so many improvements in this education quality and in teacher qualifications, but yet they have no plan in order to help with additional funding for these programs, but with instead much less in funding than Head Start programs have already lacked in over the years. In the fourth subclaim, the evaluation system forces already low-income teachers to be required to become greater qualified to teach Head Start classrooms. Federal lawmakers authorized the creation of the Centers of Excellence in Early Childhood to recognize programs of exceptional quality. And in 2009, they approved $2 million to fund 10 of these centers for a period of up to 5 years. This means that out of the 1,800 Head Start programs around the nation, only 10, that is 10, receive these enormous funds to improve Head Start teacher qualifications and education programs. The other 1,790 programs will not receive this funding on top of additional grants and funding cuts already pushed upon them. This is money better spent improving underachieving programs than further improving those which are already award-winning of excellence. Preschool for disadvantaged children should not be another casualty of the budget wars in government. Without proper funding and support from the government in aiding these programs to improve standards, it is no one else but the already disadvantaged children of Head Start programs who will truly suffer when they are already suffering as it is. Kathleen Siliubis, the Secretary of Health and Human Services, has stated that research clearly shows that Head Start positively impacts the school readiness of low-income children. Now we must increase its effectiveness and continue to provide the support that our children from birth to age 8 who need to prepare to succeed later in school and in life. In closing, the new evaluation system for Head Start, which has taken effect this year, negatively affects Head Start programs nationwide. This new evaluation system will cut vital funding to Head Start programs. The topics discussed were cuts in education, high qualification requirements for teachers, and closing down of the underfunded Head Start programs. While quality varies widely among Head Start programs, there is little doubt that Head Start is critically important for these children and their parents. Let us not allow government to rob the most precious of resources from our children. Thank you.